Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
Chronic pain, I injure it like maybe about once a month if I'm trying to work out.
A month ago, you mean?
Yeah.
Okay.
And it's an injury in the same location, upper back, the left side. And it might have to do with my neck or my upper back, like what you're.
Okay. So how did you injure it?
If I'm at the gym, it could be a number of things. It could be if I'm doing a bench press, if I'm doing a military press, my upper shoulder or upper back always cramped in the same location, and it's always there. So I'm not quite sure.
So you have a constant pain. How much constant pain from 0 to 10?
On days that it's a good pain, maybe a 3 or 4. But on the really bad days, it will range between 6 and 8 or 9. Okay,
how much pain do you feel right now?
Right now in the morning, after I shower and my body warms up, it's not too bad. Right now, maybe a 4, but as the day goes on and I start getting fatigued at school or at work, it becomes a 6, 7.
6. Yeah. What kind of pain? Sharp belly?
If I push my head down or if I try to go out this way or this way, the farther I go, the sharper the pain gets.
Where do you get it?
It would be close to my spine.
Yeah.
Yeah, close to my spine, but still in the left upper region. Or if I'm driving for too long and I try to look over my shoulder, my blind spot, like there, it hurts.
So how much now will you turn?
So here it's still like a 4, but if I go up to here, it's 6, 7. It's just shooting up.
So let's do the range of motion and give me numbers, okay?
Okay.
I can extend.
Here nothing.
Okay. Flex.
And here's that's where it starts. 6, 7.
6, 7. Okay. Rotate left and right.
So here it hurts maybe 6 or so right here. This way nothing.
Yeah, that's a little bit side bend left and right.
So here I feel the strain.
Okay.
Right here. It's not horrible pain, but it doesn't let me go any farther. Okay. And this way I can just go that way. That's
it's feel like stuck. Yeah.
Yeah.
And the pain is just going down this way.
Yeah, it shoots this way.
Have you had any treatment? This been going on for almost some months.
I have a foam roller.
Okay.
That's pretty much it. Yeah.
Okay. So let's flex your head down. Okay. All right. So you can see actually this 20. This is 40 degrees here. 40 degrees. Go backward. It's not bad actually. Okay, and this is like 55 here. 55. Between 50 and 60. Okay. Turn your head to the right. So. Okay. So this is 65 here. 65. Turn it the other way. It's not okay. And this is okay. So it's 35 here. Okay. So this one is 35. 1 second. Sorry. Here you go.
Dominican.
Okay. 45. That's not bad. That's normal. Okay. Let's go to the other side. It's not the best position, but here you go. And this one is 45. Like that, okay. So most of your limitation is flexion and rotation this side. Okay. I already felt it's gone actually. That's not. Can you tell the difference or? Yeah, you feel this little knot here?
Yeah.
It was bigger on the other side. Okay. So I'm just gonna work on releasing that. Okay. So if it's too much. Have you had any headaches?
I had one yesterday, but
Mm-hmm.
I drove about maybe 10 hours or so yesterday.
Wow.
So it's just from that, I believe.
Yeah. Where'd you get the headaches?
Front, upper, above my forehead.
Here?
Yeah, above my
This area?
like the eye ridge.
Yeah. You feel the tightness here? It's
Yep.
flashes are tight here. Okay. Sure this is not. Okay. Feel that bump here?
Yeah.
That's the scar tissue.
That's like a lot in there.
Yeah, yeah. So all that, like, this is the line, yeah?
Yeah.
Okay. You see the redness, that's actually most of the scar tissue, where he has the redness here, here, this seems to be okay. So a couple of things we can detect the scar tissue with ASTR tools. A little bit redness, you feel the bump, you know, the patient can feel it, and I feel vibration actually with the tools. The design and the material help me to really detect it very easily. Okay, that's good. Let me clean this up.
I feel a lot looser now than I can.
You're not making faces, you see that?
No.
Yeah.
It's like very, very big. Maybe like a 1 out of 10.
Where do you feel it?
It's very deep inside the muscle.
Right in here.
Yeah, a little bit
Right.
more. Like, yeah.
Right,
That's-
right in here. Yeah. Here?
Yeah, in there somewhere.
Right in here, yeah?
Yep.
Okay.
Right there.
Make sure this is not too much, okay? So this redness should disappear in 10-15 minutes. Too much or it's okay?
Oh, that's great. Yeah.
And tell me how that feel. How's that?
Yep, it's done.
Going further. Yeah. Other way.
Yeah, nothing here.
It's beautiful. Extend and flex. I think the flexion was the limitation.
Yeah. It feels looser though when I go up. I
Okay.
don't feel much tension back here. When
Yeah. And go down.
nope, no pain.
No pain? Okay. Side bend left and right. That's beautiful. You actually go further, yeah. That's nice.
And here, that same little tiny pain came back, but obviously a lot less.
How much?
Um,
You're going further, actually. Yeah.
maybe it's just a 2 if anything. Maybe 1.
In
out of
that
10.
spot?
Yeah.
Okay. Okay. So side bend now and tell me how that feel.
That's better. Yeah.
Gone or still feel it?
I didn't feel it that time. Was it? I don't feel it.
We don't feel it. Okay. Let me take your range of motion again. Okay, so we have the numbers. So flexion was 40. Okay. So let's flex. Go down. Okay. Right. So that is 50 degrees here. Flexion. Okay. Extend. That was, let's see, 55. Oh wow, look at that. 78. You see, 50, 60, should be 70 here. 78. That's a good range of motion. Yeah. 78 and that's 50. Rotation was 65 this way and 35 this way. So let's rotate this side. I'm sorry. So that was 65, now it's 85. Here, because this is 9. Okay, let's go to the other side. That was 35. Okay. That was 35, now this is like 70, almost 70. 78, almost 78. Right. Extend and flex. How's that?
Yeah, I don't feel the tightness anymore. That was
Any pain or it's gone?
not pain anymore.
Beautiful. So, what do you think about ASTR treatment?
Well, it definitely works.
Yeah, awesome.
Yeah, it's interesting.
Yeah.
I have a massage therapy background, but
Mhm.
it's different doing it with your hands.
Yeah.
I get the scar tissue.
So I worked on the scar tissue, and actually I worked on the superficial fascia, the
Okay.
apparatic fascia, and the premisin, endomysin, and
Right.
I use those
Okay.
tools to do that. So it's definitely, yeah. Can you tell, like, from your background, what's different between using tools and just using your hands?
Well, I heard you comment that you can probably feel the vibration on the actual tool.
Yes.
So although you can feel it on your fingertips, but I don't think you can go fast enough with your fingers.
Yeah.
Right? On tissue to feel that vibration.
Yeah.
So you'll feel individual knots,
Mm-hmm.
but because I guess it's flat, you're able to feel like exactly.
Give you more
tiny
feedback.
micro- Yeah.
Yes.
Yeah,
Yeah.
so that's cool.
Yeah.
That might definitely be an advantage to using that in your hands.
Mm-hmm.
And it's not so much wear and tear on your hands.
Yeah. It's very easy
Right.
to use this tool. Yeah. Yeah.
That's cool. That's great. Yeah.
Yeah.
Appreciate it.
Awesome.
Thank you.
Yeah. Thank you so much.
Of course.
Thank you. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.